Hi, dear listeners, and welcome back to Blush and Bloom, the podcast where we talk about women's health, self care, and everything in between. I'm your host, Gigi, founder of Asele, your space for cycle aware and preventive care. I'm really glad you're here with me on this journey to unpack women's health and highlight the incredible things being built in this space. So let's get into today's episode. All right. Hi, Aline. Thank you so much for joining me on the Blush and Blue podcast. So, for someone who's meeting you for the first time, how would you introduce yourself and the work that you do?
Hi, Gigi. Well, thank you for inviting me. Very, very happy to be here today. So I define myself as digital health connector. So that's what I do and who I am. So it's the company that I created, like as an umbrella for all the activities that I do, which are mainly connecting the different actors of the digital health ecosystem with a focus on startups. So I really believe that innovation coming from small companies and innovative companies can have an impact in healthcare. And my mission in life, it's like bringing or helping bring those solutions to the people who need them the most.
That sounds like a very wonderful mission. So you described digital health as a love story in your LinkedIn bio. So and this has been going on with you for more than a decade. So can you just tell us a bit about how that started?
Sure. So yeah, I'm very fan of the way it started. Actually, I think it's really like exactly like a love story, something that came up out of nowhere that I didn't expect. I didn't look for it. So I was actually taking my master here in Barcelona, and there was an event where students were meeting startups for the summer internship, and I was talking with my French friend from the class, and someone came and like, look, she speaks French. So it was the founder, Dr. Alia, was actually looking for a French person. So we started talking, and it was healthcare, sales. And I'm like, no, thank you. And then we keep talking, and I accepted the job. And my very first day was on my birthday, and it was in Madrid, like an event with like 100 doctors and nurses who were talking about blogging, like tweeting. It was absolutely amazing. And I think that's how it started. Like I loved it from day one, and it just kept going on and on for all those years. And I think it's still very strong today.
All right, that's really cool. And before you moved into health tech, you used to support sales with trucks and spare parts. So I'm trying to this is such an interesting background. So how did you learn any lessons along the way that helps you connect with people in health tech, or this is just something that happened to be?
So it happened to be, but I learned so much from that experience. The first one is that go out of your comfort zone, because that was actually not planned. Like I was in that company in the UK for an internship in the export department. So doing more business development with other countries. And my colleague was going on holiday, the one doing after sales, and there was nobody to cover him. So I said, well, I can do it. So I volunteered. I just ended up like being on the phone talking to men about the parts for the trucks. And on top of that, there was actually people from Manchester, from Scotland, from Wales, and I had difficulty understanding the accent at that point. So it was like a big challenge, but I learned so much from that. So, and then this part of adaptability, something that I learned very quickly, because being on the phone, they were trying to tell me what they needed. I was struggling a bit. So what I did, I'm very proud of that. I went to speak to the engineer team, and they gave me like exploded view of the different trucks. We put numbers and name next to each number. And then when people wanted spare parts, I was just sending them that document, and they were telling me the numbers that they needed. And that worked so well. So a very cool solution to a concrete problem. And I learned also a lot about teamwork, because when you do after sales, you have to coordinate with lots of people. So my colleagues on the show floor were preparing the parts, the shipping company that were coming to pick up the parcels, account department for the payments, and then the customers for them to be happy, no? And then maybe also the last thing that I learned a lot was about customer service, because it was after sales, and so I was also helping men to fix their truck. So when they had an issue, they were calling me. For me, after sales is just in customer service is so important. Like when you buy a product, it doesn't stop when you sell that product. It goes beyond. And I think we all know that if the customer service and after sale is good, that's when you're going to go back to a company. So that's something that I really took from that experience.
All right, that's really cool, and I loved how you created this innovative approach that helped you handle like the new situation that you were in. Like, that's so cool. Okay, so let's talk a bit more, leaving that aspect. Now I'm going back to digital health. So what moment convinced you that I think you already like talked about this earlier, but what moment really convinced you that digital health could truly change people's lives?
So I think it was actually when I went to bigger conferences. So I went to a Doctors NU in Paris, to a Health 2.0 in Europe, and also in the US after that. And those conferences were really focused on digital health. They were like the first conferences to do that in Europe and in the US. And they had a big focus on startups. So showcasing startups with innovative solutions, but also patients. And I think that specific experience, listening to patients, sharing the experience, and how technology and communities help them, that was just like, yeah, I think that's that specific moment. I think one of my first conferences was ePatient Dave, which is like a very patient advocate, very famous patient advocate in the US. And there's one also that marked me a lot is he was a young doctor called Davin Paschenbaum, and he had a disease. They couldn't find the cure for that. And he nearly died a couple of times. And at some point, with like repurposing drug, they actually find a cure for his disease. And it is here today, and he's very, very healthy. And he started a company called Every Cure. And for me, that's an amazing example of how technology can really make a difference. And when I see those testimonies from patients, that it really reminds me why I am doing what I'm doing.
All right, that's really exciting. Okay, so you've worked with corporates, you worked with accelerators, you worked with startups. Which experience has shaped you the most and why?
So yeah, I've worked and I still work with all the different actors of the ecosystem. So corporate, hospitals, pharma companies, insurance, investors. And for me, that's important because my mission in life is really to help startups. So working with those different actors, it helps them to understand how they work, what they're looking for. And then I can bring that back to the startups. But maybe what really shaped me the most was actually the accelerators. You know, when you work hand in hand with those startups, those innovators who have amazing ideas, and they're really those who are gonna make a difference. So in the accelerators, for me, it's really an exchange. Like you bring your knowledge to them, and for me, it's what I'm learning from the different actors of the ecosystem. But you also learn a lot from them. So it's really that exchange of knowledge and going hand in hand to solve problems together.
Thank you so much for sharing that. And speaking of the ecosystem, so you've worked closely with the Femtech community in Spain. So, and you've also like mapping the Femtech ecosystem there. So what trends do you see shaping the next wave of women's health innovation?
So I think the next wave of Femtech solution, women's health solution, is going to be more connected. So we are seeing that already, you know, like
Yeah.
I'm tracking my my period, like using my Oura. I'm actually three different apps on my phone, but Oura is the one that's really picking up. You know, I'm not doing too much with that. I think it's really learning from me based on my data. The other apps, I'm actually manually entering the data. So I think that's what we're gonna see, like recommendations and analysis based on our data. So being able to collect different data. And I think also next generation is gonna be more medical devices. Right now, it's more consumer solutions. But I think solutions are moving more and more to be medical devices, medical grades. And that will be also easier to integrate with hospitals and other actors. And I can see also like solutions merging or being more complete, because right now there's like different solutions on the market, and it's amazing because we need to address like all the different issues of the woman, but like you may end up with like 4 or 5 solutions on your phone. And I think it would be nice to actually consolidate and to have one solution that can address the different issues. And that also leads to consolidation in the ecosystem in terms of companies out there. Because we see lots of companies working on the same solution, and the market is what it is. But now we have like lots of players for the same market, and I think we're gonna see like M&As and companies partnering, so they can just join efforts, going to the same market and tackling that one problem.
All right. That's really cool. I love that you mentioned like building medical devices. I think I spoke to a doctor who's also in VC. I think her name is Valerie, and we're discussing on the podcast about medical devices and how it may be a bit difficult over time. Maybe it might be different. But we're basically discussing how like the speculum, we're chatting about speculum, I think, and we were talking about how there have been innovations in this space around how the speculum could be a better product. So women are innovating like other tools for this, but then it's difficult for it to spread across hospitals for doctors to actually like want to learn how to use this new tool. Like, do they want to? And because women's pain has been overlooked over time, so women are actually building it, but it's the products that they're innovating aren't being distributed. So I love that you mentioned this. And what do you think?
Yeah, so I think this is also linked to there's often solutions who are arriving to the market and they actually don't meet what the end users need, being the healthcare professionals or the consumers. So that's why it's actually so important to collaborate with healthcare professionals, of your end user, to understand what they need and to co-create those solutions together from day one. Because you're absolutely right. That's what we see a lot. And I talk with lots of healthcare professionals, so for Femtech and for other topics, and they're already like overload, lots of work to do. And they see that innovation like as a threat, something that's gonna add work to their days. So it's also important to sit down with those healthcare professionals and to explain them the benefits so they understand and that they see it as a support as it is, and not that something that's gonna add more work to their days.
Okay. And then I have a personal unrelated question to this that may sound a bit daft because I could just Google it. But what's the difference between having a wearable watch and an Oura ring?
So they're collecting more or less the same thing. I think it's a question of a preference. So I prefer ring. I don't feel it anymore. Like it's on my finger. I don't wear watch, but I know that some friends they prefer watch. I think it's more of a preference because you have about the same.
Okay. I thought there was more to it. Okay, that's cool. I mean, to be fair, like I think we also talked about there's this new earring for tracking things now. So it's more like if you don't like wearing a watch, wear something else.
Exactly. I'm very excited about this one.
Yeah.
I think it's great.
All right, awesome. So another question I have for you is startups often struggle to bridge the gap between great ideas and adoption. We talked about this. So what do you think separates those who succeed with doing this and those who don't?
So I think it comes back a bit to what we were mentioning before, to identify, to understand well your customer, and to identify the unmet need. So that means, when you're a startup and you prepare your persona, so you have to understand well, like, who is your customer, what do they like, what do they want. And I think that's really key, and to include them early, so you will have some hypotheses and you need to validate those hypotheses with them. And you also need to understand like the day to day, what do they do, what's the workflow at the hospital, for instance. And maybe an example of the company that's doing that very well for me, it's Alan. So Alan is an insurance company from France. They're one of the unicorns. The design is amazing. I'm a big fan. If you Google them, you see like the small like fluffy bear. So they are digital insurance. So you subscribe online. Everything is happening online. It's way faster, and they've really evolved those past years, like adding more. And it's very focused to the new generations, understanding what people want. They don't want to queue. They don't want to go somewhere. Everything has to happen online. And I think that's really their strength. They've managed that very, very well. And I would say another reason that explains why companies are succeeding over others, understanding the ecosystem and mapping the ecosystem. So you've got different players in the ecosystem. And when you are a startup, they will be part of what you're going to be doing. You need to understand how they work, what they want. If you want to go to a hospital, work with a hospital, you need to understand that workflow. You need to understand the sales circle. You need to understand the type of regulation that they're expecting, etc. The same for insurance company, for instance. If you want to work with insurance, you should speak to them early because they will have special requirements. And it's better if you include that in the development of the application early rather than going to them when your solution is ready and do some changes. You're going to save time and money as well, no? And then I think also something that, especially in health tech and femtech, I would say, that differentiates people who succeed or not is to have a solid scientific background. I think that's important to prove with like either clinical validation or real world evidence that that solution is working. And we were talking about speculum before, something like Day in the UK. They've been developing a solution that could replace the speculum. You can actually do the test at home and you send it back in the post and you receive the results on your phone. And they published a paper showing that that was actually as or more efficient than going to the gynecologist once a year. So that scientific validation is very important, especially when you want to work with a hospital and with doctors.
Okay, that makes sense. Okay, thank you so much for sharing that. It reminded me of the conversation I had with Ida when she mentions the process, the FDA submission process with that they had to go through for Clue. So, all right, this is interesting. Okay, so you mentor founders on business models and fundraising. What advice do you find yourself giving women founders most often, aside this one you just mentioned?
Yeah, exactly. But maybe to add a bit to that, I don't really give specific advice to women. You know, I advise startups. I don't think I actually have really specific. I really treat them equally, and I think the basis is the same. So what we were saying before, to have a clear unmet need, so that's something missing often. You know, to understand well who is your customer, what's the pain point, and who is affected by the pain point. That's very important because it's the person who is going to pay. So if we talk about Femtech, the person with the pain will be the woman, but the person affected by the problem will be paying for it, maybe the insurance company or the hospital. It's different. So you have to have that very clear to understand who is paying because that's a business and the money should flow. And you need to have like a clear value proposition and also make clear how you're different from other companies in the ecosystem. Also important we mentioned that before, you will have hypotheses to validate those hypotheses. So go out there and validate with people that what you think is right and have a clear roadmap. So that's very important. Like when you're going to talk to investors or to hospitals, like what are you going to be doing? If we talk about regulation, for instance, that takes time and money. So it's important to have it on the map so you can anticipate, you know, when to start, you know how much it's going to cost you. So you know how much to ask investors, etc. And maybe specific recommendation when it comes to investment, delay investors' money as much as possible. So when you're early, try to go and apply for grants, go to competition where you can get some like money prices. But yeah, delay that money from investors as much as possible because once you have money from investors, you are losing equity from your company and you're losing like a bit of power, and then someone else also has a say in your company. So it can bring value. Yeah, it's also when you go to investors, it's also more difficult if your cap table already has like quite some people on it. It will be less attractive for an investor to join you and to invest in you. And maybe the last tip is, you know, I'm all about networking communities. So to join those communities, to be surrounded by other people that can inspire you, that can be your future customers, etc.
All right. Thank you so much for sharing that. That was really insightful. Okay. So you've talked about venture clienting, and when I said on your profile, that was the first time I've heard about it. So could you please share what it is? What's the process like?
Yeah, I discovered it a few years ago myself. I think it's not new, but you know, like one day you learn something new. And I think it's an interesting model, no? That's when like a corporate, so especially pharma, hospital, insurance are becoming your clients. So they're paying you to use your services. So as a startup, that's amazing because those companies, they are big. So you can have like big contracts, no? And they can become your initial clients. And I think in the case of Femtech, it especially makes sense if we talk about pharma companies, because we know that there's lots of interest in women's health. So pharma companies are working on different verticals. We know that there's still some gaps in terms of knowledge, in terms of science around different conditions. So Bayer, for instance, is very involved in endometriosis and menopause, though they have stopped R&D, but that was really their focus. AstraZeneca more on breast cancer, GSK is more on gynecological cancer, Gedeon on like all types of women's health cancer. So there's opportunity there. And I think mentalities are also evolving, where the pharma want to have like a more holistic view of the patient. So it's not just providing a drug, but they want to support them in like the patient journey. So if you have a Femtech solution, you can either like help them bridge a gap if they don't have a solution, like menopause, that's complicated. So maybe your solution can help them with that. They can offer an extra product, and maybe they can support a drug that they already have on the market that can support those women. So for you as a startup working in that format, you can actually also have access to real world use cases or lots of data for you to validate your solution even more. And being the client, it's also, you get some revenue. So it helps you like go on and like scale up a bit faster. And maybe another advantage that some companies are using, it's those pharma companies are very well established with gynecologists and other type of healthcare professionals, and they can help you like distribute your solution. Because when you start up, it's not easy to have like a sales force to go and sell your solution. So you can actually rely on those big corporations to promote your solution when they're going to see their clients already.
So I have a question for you, and it's okay if it's a confidential client or something, just let me know. So do you have a particular client that's actually like doing this, and how is it going for them? Because I can only imagine the amount of bureaucracy and paperwork they'll have to do to be able to pull this off and secure this kind of partnership.
In women's health, no, but Bayer was doing bits. So they can do it two way. They can do like a contract, or they can do a bundle. So they do contract and investment at the same time. So that's what Bayer did more. Yeah.
Okay. Thank you so much for sharing. All right. So we are headed towards the end of the podcast. So I have a couple questions for you left. What excites you the most about the future of innovation in healthcare, digital health, women's health, personalized medicine, genomics? Is there anything that you're super excited about? I mean, aside the wearables like the earring, is there any other thing that you think is super cool?
No, actually, I'm very, very much looking forward to like personalized medicine genomics. I recently did my genomic test with my hospital here in Spain. And I think it's amazing because you get like lots of information about yourself, and you can use that information towards prevention. So then they have like a special program, like depending on the results, to work on some aspects of your life or your health to prevent those conditions to happen. And in the case of women's health, I think that will help like for women to be more empowered, to know ourselves better, because we know today that there's still lots of gaps around different things like menopause and other conditions. And there's also the fact that we know that women are living longer, but they're also living with more pain. And I feel, so I'm hopeful that although that space, like personalized medicine, like genomics, will actually help to identify like some causes of the pain. And we have some like digital therapeutic solution that can help address some of the symptoms. So that's why my hope will actually women will be able to live longer, but better and healthier without.
This, I think maybe you might like to talk to Dr. Valerie, because she also mentioned this, that women are living longer, but I don't know if she said longer per se, but the women's health, I can't remember. She puts it like, she's so smart. She put it like some kind of fancy doctor speak, but basically it was around like the women's, okay, I'm trying to, at least say morbidity or something. She said it better, but it was along the lines of women are living lives through so much pain, and the pain has been ignored for so long, and we're all happy that this pain is being explored, and now we're understanding that some of this a lot of this pain isn't normal and this is how we can fix it. So I'm happy that this came up during the conversation again. Okay, so if you could leave one message for a woman who is listening to this podcast, she could be a founder, she could be just a woman who is interested in women's health and learning more about her body, what would you tell her?
I think I would tell her the world needs you, because we need women to be very involved, like we need to be in the driver's seat. And as you said, if we are founders, for founders to keep working on those amazing solutions they are working on, that will have an impact. Investors to invest in those solutions to support those founders, and women, just every woman, because those data are coming from us and they need to share how they feel, what are the pains. That's how we can advance healthcare in general for all of us.
All right, thank you so much. I just remembered that I forgot to add this to the list of questions because I always have to ask somebody this question. What are your thoughts on AI?
So I think AI is really gonna revolutionize the future. For digital health, it's really making a difference. It's really making sense. It's helping to triage, to organize information. And then we've got the AI agents that really be a support for healthcare professionals. So I still see AI as a support that help healthcare professionals and us as patients to be more efficient, to know more, but really to make that easier for us. I think it may happen at some point, but right now, people should see it as a support to help them to take some workload out of them. But yeah, AI is like, it's a must. We have to embrace it.
Yeah.
Yeah.
Okay. Thank you so much for sharing that. And what would you tell 15-year-old you?
So I will tell her to trust yourself, go out of your comfort zone and explore. So it's very funny because 15 years old me was a very shy girl living in the countryside in France. And then when I was 21, that's when I left my house. I went to Spain. Really, I never came back, and everybody was really surprising. Wow, is that really the girl that was at home? And I think I was telling the 15 years old me what has been happening after that, she would not have believed it. So yeah.
That's so sweet. Thank you so much for sharing that. Okay. And final question. So for somebody who wants to learn more about you and your work, where can they find you?
So I have my website, digitalhealthconnector.com, where I publish digital health events. So like not all of them, but like a few of them that I recommend. The biggest one for people to go. I have a podcast also that we're doing every month with my friends. It's called the Health Enthusiasm Podcast, where we share about news that we read during the month and we comment it together. We talk a lot about AI as well. And then LinkedIn is also a good place to find me. I communicate a lot. I share information about conferences, about open calls for startups to apply, etc.
All right. Thank you. I will try to include all the links in the description and in the show notes. Thank you so much, Aline. It's been a pleasure learning more about you and your perspective on women's health, digital health in general. Thank you so much for being on the podcast.
Thank you so much, Gigi, for the invitation. Bye.
Hi again. Thank you so much for listening to this episode of Blush and Bloom. I'm so glad you joined me for this conversation. If you found it helpful, please share this episode with a friend or someone who might need it. Let's keep talking about women's health and working towards better outcomes for all of us. You can find more episodes and resources at www.asele.tech and check out our app at www.asele.health. And you can follow us for more updates on Instagram at asele.tech. Until next time, I'll see you in the next episode. Take care and bye-bye.